So I think we must be very clear that we are not doing technology without skills. If you have no skills, then technology doesn't come in. And if you don't believe in technology, then stop doing all those complex platings and double platings and 3D CTs, and let's go back to the dinosaur age and start fixing what we did in the previous time and continue to treat everything like Sarmiento. We're not denying Sarmiento. But when it comes to the road traffic accidents and problems that we face these days, day and age, we need the crutch of technology to lead us where we are today and on this podium, number one. I think Rujuta conceded everything when she said boys with toys are the younger ones, and we accept that blame. We will accept that from the senior orthopedic opponents on the other team. Thank you very much. But this is a reality check. We are not talking about cinema and 3D. We're talking science, so we'll head off science. So I have my 2 minutes to talk on shoulder and knee related injuries, and this is announcing the epitaph for old technology. We have to move on. If we don't move on and go high tech, and this is a no-brainer. All of us agree that the 3 Tesla MRI has changed our perspective completely. The 0.5 Tesla MRI should go down. Not even in Africa. They are not ready to take our 0.5 Tesla machines at all. It just eliminated so much garbage. We don't need our arthrograms. But we must again, before they start arguing on this count, you need the clinical skills to diagnose a rotator cuff tear before you send the patient for a 3 Tesla. We are not here to debate that. How do you know? We have to have the basic clinical skill set and then move on. 50 years back, we didn't have this. So patients had rotator cuff tears, they went on to cuff tear arthropathy, they had pseudo paralysis, they were miserable. The reverse shoulder was introduced in 2010. Till then, please don't ask me how we treated our patients, because those patients did not have a recourse, and technology has helped us lead up there. You're seeing comparison images between a 0.5 and 0.3, and you don't need to be a shoulder surgeon to delineate anatomy. It's like grace. We've actually eliminated the radiologist from the argument. We stopped reading reports because we can read our own 3 Tesla MRIs because they're like the book of anatomy written by Gray. So that is science, and that's a given. I bet nobody can contest me on that. So let's not go down to old technology and say that I can diagnose frozen shoulder on X-rays, I don't need MRIs. If we didn't do MRIs on these patients, then we are doing a great disservice to the shoulder patients. Now this should be a test case that I know that fractures were treated, and you can quote Cochrane reviews on conservatively treated proximal humerus fractures and fixed proximal humerus fractures. But if you look deep down and read between the lines, those reviews are of younger patients. When you're dealing with 70+ patients, they are not included in those reviews. In those reviews, like the Proffer study that was done in UK, they said that conservative was okay. There were no elderly patients. There were no reverse shoulder arthroplasty. So obviously, you have condemned your results to ordinary before even your trial has started. So this is where you need a discerning person with experience, with understanding, who can read through those reports. Now these are 70-year-old patients. I'll just put one case here, proximal fractures. I know nobody is going to conserve that. And this 72-year-old lady, who by the way happens to be a mother of 2 doctors who are practicing in England, and they did not come down for this surgery because they were told it's a standard routine surgery, don't bother. And this lady underwent a lock plate. And then 72, everything fell apart, and then they came down and they had to cut down their business. They were here for 2 months. And at 70, it is given, if you look through the literature, you don't want to do fixation. You want to do a primary reverse shoulder arthroplasty. That's high technology for me. So I have my skill sets, and I complement that with a new technology like this. And you see that 8 weeks post-op, you've seen everything nicely ossified with the rotator cuff. Is the most stable way to treat these patients. Today, I would treat these patients primarily with a reverse, not with conservative treatment at all. And they have to. Seeing is believing, Sandeep. Seeing is believing. This poor lady at 72, second surgery. And this, by the way, this is a result for a revision patient. This is not a primary patient. The primary patient is going to do far superior than this. And if before you make a judgment call, please speak to her son-in-law and please speak to her daughter who are doctors in UK. And now we take it to a much further level. This is the Steve Jobs of shoulder replacement. This is current technology available in India, practiced in Pune. We are talking about ceramic. We are talking about stemless prosthesis. We are doing this. This is not some sci-fi fiction which is done in a Harvard research lab. And like the skirts, the stems are getting shorter and shorter for a very good, valid reason. Because we invested in technology, we invested in science and research, and we realized that we can do far better because now we have far superior materials because of technology. We don't need that long stem to make that processes stable. This is the future. This is the future. Okay?
Ashish.
Just one last slide. One last slide. I just need one slide to lay to rest the old technology of open ACL versus arthroscopic ACL. I mean, you don't want to be a hideous member there on the left side of the screen who had to undergo an open ACL, a cast for 8 weeks, and recovery of 1 year. We just dissuaded patients from coming in for surgery. And the arthroscopic thing is they go walking back next day. That is technology. Both required skilled surgeons. Both were the same surgeons, but the surgeon who used to do the open ACL 15 years back or maybe 30 years back has evolved into a technology competent surgeon to give best result. And those who are still naysayers and who refuse to accede to technology, ask yourself, if you had an ACL, how would you treat yourself?